Chris Byer.
Chris Bowling.
Brad Johnson.
Gentlemen, we meet again.
We do. Good to see you.
Yes.
What is the next hot topic for Bottom Line Thursdays?
Yeah, I was looking at Brad's newsletter, as we said in a previous one. Chris, I do read it. So, I am well prepared.
Yeah. Yeah. Well, I have good news. And it's not going to be a save money on car insurance joke. But I couldn't help myself. So, this obviously COVID been a bad thing for everybody.
Yes.
But it's now the national emergency has expired. And I think what's confusing, they're even talking about the national emergency and the public health COVID-19 aspect of the emergency, which technically are two different things. Don't know why, but they are. But because that declaration has been made, that means some of these extensions and all those things going on is going to be coming to an end May 11th to revert back to pre-COVID things. So, Chris, you're shaking your head. Sounds like you've been down this path already with some groups.
Yeah, and also, not only federally, but I know state of Illinois has mirrored those same deadlines. So everything that was in place for Illinois' pandemic response is ending May 11th. And it's, there's a lot of things that are going away for the employees and the members on these health plans. Things like special enrollment period due to HIPAA and, being able to join the plan outside of open enrollment due to the emergency room. We've also seen, some of our HR teams struggle with COBRA because members could go back and elect back to the start of the pandemic on COBRA. And there was that additional time frame as a look back, which had never been there before, just difficult for administrating the plan. And then, a lot of the COVID-19 testing and care is not going to be cost shared the way it was prior to the pandemic. So all of our fully insured plans paid for COVID care at 100%, testing at 100%. Self-funded plans could opt in to do that the same way. Some did, some didn't, but that goes away. And COVID certainly hasn't gone away. There's still people going through that. So May 11th is a big set of change for the members, but I think also a step back for the administrative side for our plan administrators, a little less chaos for them. And they can go back to managing the rest of the aspects of their job.
So did either
to the old confusing rules?
Yeah. So
the old confusing rules.
So did either of you have an employer that had to enroll somebody going way back for COBRA?
Yeah. So I think mine was about 6 or 9 months. I think
I had one.
Yeah. Not as many as you would think. Yours was how far?
A year. And it was a nightmare because then it was all these claims that they now had to pay, which this person, I still don't understand the circumstance around why we had to go back. I mean, were they uninsured? Were they under somebody else's plan? Yeah, it was a train wreck to try to get all these claims reprocessed
I don't think we saw as much participation just because you're still paying COBRA premium. But shoot, if you come down with COVID bad and you're not on the plan, you're going to be looking back to that, or the hospital. We saw that happen more hospital systems, more providers paying that COBRA premium so that individual is not uninsured.
Yeah. Yep. Me too.
But yes, I mean, other than that, I'm sure there's going to be more changes coming, but it finally feels like we're getting away from the extra workload, and now something else can take up that extra workload. I'm sure.
Yeah, so the zero cost telehealth option that's set outside of this, correct? It was part of a different law that was passed, and is that expiring anytime soon, or is it really back to employer choice?
It did expire to start 2022. It was passed again in April of 22, expired end of 22. The CAA put it back in for 1/1 of 23 for virtual visits and telehealth to be potentially no cost for a HSA plan. A lot of the fully insured groups have not moved that because that's carrier decision, but most of our self-funded plans have made that a zero cost share. And that was nice to see it finally passed in a true spending bill and not just an emergency order, because it got confusing.
Yeah, horribly.
Yeah.
Yes, because I'm on an HSA. My wife, this was probably November, and she had to do a telehealth and had to pay for it. And I was like, wait a minute. Are you sure we have to pay for this? So, she entered in all of her credit card information. I have no idea if they charge me or not. That tells you how diligent I am about looking at my credit card statements. So
statements and Brad's bottom line, the two things Chris doesn't read.
But he doesn't have to read them because we just covered.
That's
we
right.
covered
He's
the
probably
good
more
stuff.
efficient than us, Brad. You're writing it. I'm
Yeah.
reading it. Chris is just absorbing it. So well
Yeah,
done.
He's a smart one.
Normally I read this, but if you remember,
great.
I have a very large 4/1 renewal block of business. So that is the excuse I'm using for this month. Next
Okay.
month, I have no
Right.
excuse whatsoever.
You get it fast. No, just say it was part of this national emergency. You weren't able to read it until that, came due. So
Yes, that's it. Thank you guys for a good topic.
All right.
again.
All right.
Good to see you.
bye.